Now I am going to talk to you about fetal circulation. In the fetus, the lungs are not functioning. The baby gets its oxygen from the mother through the placenta. Because the lungs are not functioning, we do not want the blood to go to the lungs for oxygenation. So we need to bypass the pulmonary circulation. There are two bypass systems in the fetus to prevent the blood from going into the lungs. The first one involves a hole between the right atrium and the left atrium. So when the deoxygenated blood comes into the right atrium, instead of it going into the right ventricle, the blood flows directly from the right atrium into the left atrium, and then into the left ventricle, and then all around the body. So we have effectively bypassed the lungs. We have bypassed the pulmonary circuit. A second backup system is always a good idea. So just in case any of the blood does leak into the right ventricle, when the right ventricle contracts, there is a second bypass system to prevent the blood from going into the lungs. And this bypass system involves a connection between the pulmonary trunk and the aorta. In between the pulmonary trunk and the aorta, there is a connection. So when the deoxygenated blood is forced out along the pulmonary trunk, instead of going to the lungs, it goes directly into the aorta and all around the body. So two bypass systems. At birth, both of these bypass systems close automatically, and the normal pattern of circulation is resumed. That means that the pulmonary circulation is initiated. Now, we can see the remnants of both of these two bypass systems in the adults. In the adults, we can see a very, very shallow depression between the right atrium and the left atrium. This is called fossa ovalis. Fossa meaning a depression, ovalis meaning oval. We can also see the remnants of the second bypass system. There is a little bit of a ligament. Can you see this white little structure here? This is a remnant of the second bypass system. You may have heard of the condition called a hole in the heart, that a baby was born with a hole in the heart. When we are talking about hole in the heart, we are not talking about a hole in the septum between the right ventricle and the left ventricle. Generally speaking, what we are talking about is that this bypass system has failed to close properly. What it means is that the hole between the right atrium and the left atrium, this foramen ovale, has failed to close at birth. And as a result, some of that deoxygenated blood is mixing with the oxygenated blood and is being circulated around the body. Now, the symptoms of that will be that the baby would be probably slightly blue in the face. They might be a bit cyanotic. That might be the first sign that something is not quite right. Generally speaking, as the child grows and develops, the hole will close by itself and nothing generally needs to be done. In fact, many adults have a partially closed foramen ovale and they live perfectly normal, healthy lives. And that is, people only discover that it isn't closed properly when they have some medical intervention. If the hole is obviously not closed at all, it's completely open, then what they will do is they will go in and they will close it surgically. It's a fairly routine, straightforward procedure.